Jai Shri Gurudev. In today's class, we will be discussing unit number 3, that is endocrine disorders. Endocrine disorders are the diseases of the endocrine system. We have studied various endocrine glands present in our body, like the hypothalamus, pituitary, thyroid, parathyroid, adrenal, testes, ovary, pancreas, and other endocrine cells. All these give out certain secretions called hormones. And if they are working properly, there will be no problem in the body. Suppose if there is a defect or there is a malfunctioning of these endocrine organs or the endocrine cells, then there will be a arising of problem in the body, that is known as endocrine disorders. And there are two main causes for the endocrine disorders. The first principal cause for the endocrine disorder is the change in the level of hormone. That is, usually particular organ at a particular time must and should secrete a required quantity of hormone. Suppose if the hormone level is increasing than the normal or decreasing than the normal, which will be a problem. That is the main cause for the endocrine disorder. Or the second principle of endocrine disorder causes is the change in the sensitivity of the receptors. In this case, the endocrine organs synthesize a required quantity of usual quantity of hormones, but the body cells do not respond in a proper way to receive the hormones. That is, change in the sensitivity of the receptors. In the target cells there will be a membrane receptors or the cytoplasm receptors present. If there is defect in the receptors, even then there is a quantity of hormone present, required amount of hormone secreted by the glands, then also which will cause a problem. Hormone will be present but there will be no interaction since the receptors are defect. These two may be the major cause for the endocrine disorder. In today's class we will discuss the causes and the symptoms of endocrine disorders like gigantism, dwarfism, and acromegaly. Gigantism Gigantism is a rare condition that causes abnormal growth in children. This change is most notable in terms of height, but girth is also affected. It occurs when the child's pituitary gland makes too much of growth hormone, which is also known as somatotrophin. Let us discuss the causes of gigantism. The first and foremost important causes for gigantism is a pituitary gland tumor. A pituitary is a small sized gland which is located at the base of the brain. It makes hormones that control many functions in our body. Suppose when there is a tumor growth on the pituitary gland, then the gland makes a far more growth hormone than the body require. So if there is huge amount of hormone which is secreted, and one of the important hormone which is directly related with the gigantism is the growth hormone. If there is a tumor in the pituitary, there will be abnormal secretion of the growth hormone secretion take place, therefore, which leads to a disorder known as gigantism. Here in this case, which is the growth hormone secretion is hiked due to the pituitary gland tumor. The second or less common causes are McCune-Albright syndrome. Thus, McCune-Albright syndrome causes abnormal growth in bone tissue, patches of light brown skin, and gland abnormalities. This is a rare condition in which there will be abnormal growth in the bone tissue take place. Hence, than the normal, there will be a growth of the children. Another less cause for the gigantism is Carney complex. This Carney complex is an inherited condition that causes non-cancerous tumors on connective tissues, or cancerous or non-cancerous endocrine tumors and spots of darker skin. Once again, in this condition, if there is cancerous or non-cancerous tumor, non-cancerous tumor on the connective tissue, or the cancerous and non-cancerous in the endocrine uh, glands, then there will be huge amount of hormone secretion taking place from the endocrine glands. This leads to again a condition known as endocrine disorder, that is gigantism. Another reason could be neurofibromatosis. Neurofibromatosis is an inherited disorder that causes tumor in the nervous system. So we know that from the hypothalamus to the pituitary gland there is a nerve connection. Neurohypophysis region is present in the pituitary gland. Suppose if there is a tumor in the nervous system, that is particularly in the central nervous system, in particular which is near or associated with the hypothalamus, then for say for the growth hormone release from the pituitary gland, there must be a triggered hormone or activating hormone required, that is the factor growth hormone releasing hormone. This neurohormone factor is necessary. If there is a tumor in the nervous system, then there will be increased rate of secretion of growth hormone releasing hormone. In turn, the pituitary secretes more and more amount of growth hormone. That leads to a condition called gigantism. And last cause of the gigantism is multiple endocrine neoplasia type 1, that is MEN1. It is also an inherited disorder that is causes tumors in the pituitary gland. Once again, there will be a tumor in the pituitary gland which increase the secretion of the growth hormone, or tumor in the pancreas which also responsible for the synthesis of growth hormone like hormone synthesis, and parathyroid gland. Likewise, in this condition, there will be a tumors in the pituitary gland or else in the pancreas or parathyroid glands. This will increase the basic metabolic pathway in the our basic metabolic rate in our body, that increase in turn the growth of the body, which leads to the condition that is gigantism. And these are the major causes for the let us know the Symptoms of gigantism, as we know, which is with abnormal height. If the child has gigantism, you will notice that there are much larger than other children of the same age. And also, some part of the body may be larger in proportion to other parts. And other common symptoms are very large hand and feet. At the right side, which is a normal hand and the normal feet, the left side, which is the gigantism condition, in which very large hands and feet seen in the gigantism. And there will be thick toes and the fingers. Usually the toes and fingers will be bulged or thick, bluffy in nature. There will be a prominent jaw and a forehead. We could observe there is a change in the facial bones, and there will be a larger jaws, especially the lower jaw is larger than the upper jaw, and the chin and cheekbone will be enlarged. Even the forehead is somewhat slant, and which gives a strange appearance to the person. And there will be coarse facial features. Coarse facial features means which include large and bulging head, and the forehead will be flat, and a bridge nose, that is at the upper side, the nose is constricted with broad fleshy tip. The tip will be fleshy and which is broad. This is coarse facial feature. And other common symptoms of gigantism are a person will have flat nose, large heads, and usually the lips and tongues are bulged in their structure. And a person may experience excessive sweating, and there will be occurrence of a severe or recurrent headache. And there is an evidence for insomnia or other sleeping disorders occur in gigantic persons. And in gigantic male or female, the puberty is delayed. In a female gigantic person, there will be irregular menstrual periods. Dwarfism. Pituitary dwarfism is a condition of growth retardation which is characterized by patients who are very short but have normal body proportions. It is mainly caused by a dysfunction of the pituitary gland. As we know, the pituitary gland has anterior pituitary lobe and posterior pituitary lobe. And anterior pituitary lobe is responsible for the production of 6 different hormones. Posterior pituitary gland is responsible for the production and storage and production of 2 hormones. Actually, the posterior pituitary does not involve in the synthesis, whereas which stores the hormones of hypothalamus, and then which is involved in the secretion. That is, the antidiuretic hormone and the oxytocin are the 2 hormones stored and secreted by the posterior pituitary gland, whereas the anterior pituitary gland gives out synthesis and gives out 6 different hormones. The first and foremost hormone is the growth hormone, adrenocorticotrophin hormone, thyro, thyroid stimulating hormone, prolactin, follicle stimulating hormone, luteinizing hormone. These are the six hormones. In particular, with this dwarfism, the first hormone, that is the growth hormone. If there is a malfunctioning of the anterior pituitary lobe, then there will be deficiency for the growth hormone. In this condition, a arising condition or disorder known as dwarfism. Growth process begins in the lower part of the forebrain in a small organ called hypothalamus. This hypothalamus releases hormones that regulate the production of other hormones. When the hypothalamus releases growth hormone releasing hormone GHRH, in turn the anterior pituitary is stimulated to release growth hormone GH. Thus, anterior pituitary hormone, that is growth hormone, acts on the liver and other tissues and stimulate them to secrete insulin like growth factor 1. Thus, insulin like growth factor 1 directly promotes the development of bone and muscles and causing bone to grow in a length and muscle to increase protein synthesis, which make more and more protein. Thus, dwarfism can result if there is a deficiency in any of these three hormones. If there is a failure in the receptor cells receiving the hormone stimuli, or if the target cell are unable to respond to these hormones, then also there will be a problem for the growth, and thus particular thing lead to a condition called dwarfism. This is the major cause for the dwarfism. Some of the minor and rare causes for dwarfisms are the specific genetic mutations that may occur in the pituitary gland or a hypothalamus gland that may cause the malsecretion of the hormone from the hypothalamus or from the pituitary gland. That could be a reason for the dwarfism, or else which could be accident related trauma to the pituitary gland. Suppose if the person undergo accident, then there will be a head injury, and in that case the pituitary gland or the hypothalamus gland cannot produce enough amount of hormone, or in certain cases the surgical injury of the pituitary also damage the pituitary gland, and in turn pituitary gland cannot produce enough hormone. Suppose if there is a tumor in the central nervous system, brain tumor, like the hypothalamus region, if there is a tumor, then also the tumor may affect the function of the hypothalamus, and thereby which reduces the synthesis of growth hormone releasing hormone, and the pituitary gland cannot synthesize, or the tumor may directly affect the function of the pituitary gland. Therefore there will be malsecretion of the growth hormone, which may lead to dwarfism. And the trauma or the pain which is there in the central nervous system is also responsible for the uh, hill secretion of the growth hormone. Suppose if the person undergoes at the earlier age for the radiation therapy or any chemical chemotherapy, then um, the nervous system, that is the hypothalamus region and the pituitary gland, cannot synthesize enough amount of hormone. And finally, if the person is having leukemia condition, blood cancer, and that may also cause the reduced secretion of the growth hormone, and all these reasons may come into account for the dwarfism. The symptoms of dwarfism include: there will be no normal growth curve pattern in the person development. In case of tumor, children and adolescents may have neurological symptoms such as headaches, vomiting, and problems with vision. The child may also have symptoms of double or blurred vision. Other common symptoms of dwarfism are: person is very short, having short trunk and a short neck, and arms and legs are very much shortened. Hands and feet are average in their size. Chest is broad and rounded. Cheekbones are slightly flattened. The foot is twisted and which is out of shape. There will be no stability in the neck bones, which may cause arthritis and problems with joint movement. Easily, a person cannot move their joints. In this case, adult height ranging from 3 feet to just over 4 feet. That is the maximum height of the person. And in this condition, um, even after reaching the teenage, a person will not develop any sexual developments, or there will be delayed sexual developments seen. Just like the gigantism, which is occurring due to the excessive secretion of the growth hormone, acromegaly is also a condition which is occurring due to the excessive secretion of the growth hormone, which is a hormonal condition that results from an excess secretion of growth hormone in the body. The extra amount of growth hormone causes excess growth in the bones and the soft tissues of the body. Children with this condition can grow to abnormal height. Even after a certain age, the growth will be prolonged. They may also have an exaggerated bone structure, and this particular thing affects the arms, legs, and face bones. As we know, the main cause for the acromegaly is the hormone which regulate the body growth. That is, growth hormone is a part of group of hormones that regulate the growth and the development of the body. People with acromegaly have too much of growth hormone secretion. This excess of the growth hormone accelerates bone growth and organ enlargement, and thus leads to a condition known as acromegaly. The symptoms of acromegaly include enlarged bone in the face, feet, and hands. Bones will be larger than the normal person. In case of women, we could observe excessive growth on the body, and the jawbone will be enlarged or tongue will be larger, and a prominent eyebrow will be seen. Excessive growth sprouts, which are more common in the people who have had abnormal growth before adolescent. And the body parts here and there will be sprouts, growth sprouts called irregular body development. And usually there will be weight gain, and joints will be swollen and painful joints that limit the growth. Usually there will be pain in the joints and the swelling seen. And the symptoms of acromegaly includes there will be space between the teeth. The teeth arrangement is somewhat different in the sense the teeth are not fused. There will be uh, space present between each of the tooth. Sprayed fingers and toes, hoarse and deep voice, uh, fatigue and headache, an inability to sleep. There will be muscle weakness, and person may experience profuse sweating, and which may lead to um, unpleasant body odor. And in this condition, the sebaceous glands are enlarged, which are the glands that produce oil in the skin. Therefore, the person will be having oily skin, and the person having thickened skin, that is, the texture of the skin is tough or rough in their texture. In the next class, we will discuss the endocrine disorders, the diabetes insipidus, cretinism, Graves' disease, and goiter. Thank you.